So once you go into this website, like the doctor, he has a few videos and he talks about and explains like why they're free, right? The whole gig. And I guess the reason why they can offer it for free is because this doctor is training other doctors from other states to come and like basically practice on live patients. And then they can provide, I mean, obviously it's not the best quality materials, but then he also says that once they receive the training, that he takes them to Mexico, to TJ, because this takes place in San Diego. Like they do the training in San Diego, and then for live patients, they go to TJ, and then they do the implants there. So these patients that are getting the implants for free are being taken over there.
Right.
Like I mean, there's so much to talk about this, but let's start with what your thoughts are.
Yeah. So this is this institute is Dr. Louis Alfajari is the guy that started it. Claims he went to Loma Linda. He didn't. Maybe he'd spent a few months there, but so you have the didactic aspect of the class work. So you know just the lectures, the PowerPoints, and all that. You know that happens in the United States in San Diego, but any treatment, any surgery, implants, or whatever they're doing, all on four mainly, is done in Mexico. And the reason for that is the liability is zero.
Oh yeah.
You know, if they were to, because these guys don't have any training. They've never been, they didn't go to school for this, so they are learning at this institute. So as a patient, you know, you see an ad, like you said, you see a clickbait ad that says free dental implants, and I see them as well. But basically how it works is, so you go as a patient, but you're being worked on by doctors who are learning how to do these procedures. Mm-hmm. And then the reason it's free is because the doctors are paying to be there to learn how to do implant surgery. So, and you know, the good thing about this is that this is what feeds all of the corporate all-on-4 centers is these doctors that go to these weekend courses. This is a weekend course. You go and you learn. You know, imagine if you're going in for and you get one shot at this. We get a lot of patients that come back from these different scenarios where they've had implants that are having to come out or, you know, having to redo the case. And you really get one shot, because once you lose all that bone after losing implants that have not been placed correctly, you know, it's really tough to regenerate that and to get it back to how it was, you know, what the original goal was to have teeth. So my point with that is this is one procedure out of many that you just don't want to cut corners. You don't want to go to guys that are just starting out, you know, a new practice that just started up. Oh, hey, we're doing implants now. They've got veneers in one room and now implants in another room because they see that's where the money is. So, but I can't stress enough the importance of going to somebody that's trained, that knows all aspects of all areas of surgery and prosthetics, and getting a job done that's done well, that will last you the rest of your life. So
yeah, this is what I was thinking, because we always talk about this, like doctors that they do weekend courses, you know, and are they really weekend, or are some courses like 6 months, or?
It varies. You know, I don't really know. You know, I went through a bona fide implant program, so I don't know, and that was 4 years dedicated strictly to implant surgery and prosthodontics. But I can't imagine in a weekend or even in 6 months being fully versed and comfortable in providing, you know, comprehensive cases that are from A to Z, start to finish, and really just hitting it on every single mark.
Yeah, that's what I was going to bring up, because you did 4 years. What I'm thinking is, how can you cram 4 years of education into a weekend course? Because there's a reason why you did 4 years, right? Because you're doing work, you're learning those entire 4 years. So like, how can they do that in a weekend course? Or are they just teaching like the surgical side of things, not really about, you know, bone grafting? Yeah. And well, again, I've never been to any of these courses, but I would imagine they have one
protocol that they're teaching, which usually it's all on 4. And so because you're just teaching one thing, they can like become pretty decent at that one thing, right? And that's why you see so many all on 4 centers. Now, if it gets beyond an all on 4 case and you start getting into situations that are more complicated, not even complicated, just more correct, more ideal for the patient, then it goes way outside their scope, and you won't even be offered that at these places. It won't be an option for you. So you'll walk in to get free dental implants or implant, all on 4 at a really low price, but that's the only option you're going to get. Mm-hmm. And I do have some photos of cases. A surgery I did yesterday, a patient who had an all on 4 on her upper, and I took photos inside the mouth so that I could demonstrate exactly, that's what she got. It was a plastic titanium framework with plastic. This is it right there. Yeah. So this is and these are denture teeth. This is pink plastic. There's a huge gap between the gum tissue and the bridge. And of course, her main complaint is that she gets chronic, constant impaction of food. She hasn't been happy with it since she had it done. Anyways, and I hate to belabor the same topic, but this is what we're up against. This is what is happening in the marketplace right now with all of these, implant centers that are literally popping up on every corner, which, in our job here, I feel like my job is just to help patients understand, exactly what, make a good choice or make a educated decision on how you and where you get the work done and how you get it done.
Yeah, for sure. I mean, not only with dental implants, doctor, but I feel like with anything, right?
Yeah.
In life, I mean, we have to do our research, right? Like we like cars, right? So we always talk about cars. We always use that as an analogy. But I mean, when you're looking for a new vehicle or like replace your vehicle, like I'd assume you do your research. When you go to a dealership, you want to know like or usually through referrals or just with anything, right? You want to find someone to do any service at home or anything like that. And that's, like you said, our goal here is to bring up these things, right? Like to show these ads, like even us showing this website, there could be viewers that are like, I want to risk it. I want to get it for free. I want to do it.
Oh yeah. But there's a market for it. Definitely.
Yeah. But we want to make sure that we cover it, right? We talk about it because it's, again, if you're going to get dental implants placed by a doctor who's barely training, like they're training on you, you know what you're getting, right?
Absolutely.
And there's actually, we have a few cases from there, right?
And if it's free, I mean, nothing is, if it sounds too good to be true, it's got to, if it's free, there's a catch, right?
Yeah.
Especially in a delicate, complicated situation, procedure like reconstructing somebody's mouth.
Yeah.
There's no way that, to do it correctly, that it's just not possible to be done for free. You know? So they're going to use the least, the materials are not going to be great. It'll be an all on 4, and the prosthesis, the teeth that are made will be very, very with the cheapest possible materials. Because the only thing that's paying for you as a patient to sit in that chair is that doctor that's learning how to work or do these cases, and he paid some form of tuition. And so that tuition is what's covering the cost of doing your case, plus all of the other things that tuition has got to cover. So your case and you as a patient, when you look at that number, let's say it's $20,000, they've got $5,000 that they can dedicate towards the completion of your mouth and your teeth, because the rest of it's going to pay instructors or whatever, right? I mean, hotels and like banquets or whatever afterwards. So the amount of money and I'm just using that as an example, but the amount of money to finish your case properly is very limited.
Yeah.